Fast facts about stuttering disorder. Stuttering, scientifically known as stammering, is a speech disorder in which the normal flow of speech is frequently disrupted by repetitions of sounds, syllables, words or phrases, pauses and prolongations that differ both in frequency and severity from those of a normally fluent speaker. The term stuttering is most often associated with involuntary sound repetition. An example of involuntary sound repetition would be 1. Trying to say the word can, but instead saying can. Oftentimes these individuals will put words together. An example would be 2. Let's go home. Not only is stuttering involuntary sound repetition, it also contains the abnormal hesitation or pausing before speech. This pause or hesitation is commonly called a block. A lot of the variables that make up true stuttering cannot be heard or seen by a listener. The things that cannot be observed include word and sound and situational fears, shame, anxiety, tension, loss of control feeling during speech. Oftentimes the most difficult aspect of the stutter or stammering disorder is the emotional state of the individual. The disorder affects about 1.5% of the world's adult population, and approximately 5% of children. A greater rate of stuttering has been observed in African and West Indies adults. These rates can be as high as 10%. Men around the globe make up about 80% of all stutterers. Part of this huge difference between male and females is attributed to the fact that women are so much more likely to outgrow or recover from the disorder. Presently there is no known cause for the disorder. There are several theories for the disorder. They can be divided into three categories. There is no known cause for stuttering. Theories about the causes of stuttering can be divided into three categories: the monster study, genetics, and childhood development. Fast facts. Stuttering usually begins in early childhood, when a child is first developing his or her speech and language skills. The majority of stutters develop between the ages of 2 and 5. Stutters can develop later in life, however, are usually through a stroke or other type of brain trauma. 50% to 70% of all stutterers are related to another stutterer. Most children go through a stage of disfluency in early speech,